Hello, and welcome to this edition of Prostate Cancer Weekly, where our aim is to help men whose prostate biopsy shows cancer make the right decision that will assure the highest possible quality of life and the best chance of long-term survival based on your specific diagnosis. My name is George Donis, and I will be your host today. I am not a medical doctor, and I'm in no way offering you medical advice. You should consult with your doctor before you make any final decision. I'm just a regular guy who had a biopsy that showed positive for cancer, for prostate cancer, more specifically. And my mission is to present you with the latest information and ideas that may help you on your journey to making your treatment decision. I'm embarking on the same journey myself, and because I'm retired, I have the luxury of time to research prostate cancer, which most of you may not have. In my short time of experience with prostate cancer, I have come to the conclusion that there is an overabundance of information, misinformation, and myths concerning what to do when you are diagnosed. I have also come to realize that a lot of men tend to panic and make the decision too fast without fully understanding the options for treatment and their side effects. Foremost, I think that when we hear the word cancer, we tend to think of it as a death sentence. Our minds just begin to run off, our emotions and thoughts of impending doom set in, remembering someone we knew or a loved one who was diagnosed with a cancer and was gone in a flash. Given any chance of immediate solution, our emotions tend to jump at the opportunity to solve our dilemma as fast as we can. With prostate cancer, this is a huge mistake. There is no going back once you've been treated. I've spoken to many men who did just that, and now they are very remorseful that they did not stop and take their time before jumping into treatment that have left them incontinent and impotent, or both. Treatments that strike at the very heart of being a man and can emotionally devastate the man for the rest of his life. In the best book I have found so far, and one that I highly recommend you read before you make any treatment decision, is called The Decision. Your prostate cancer biopsy shows cancer, now what? It's written by Dr. John C. McHugh, who is a urologist and a prostate cancer patient himself. In the book, Dr. John says, right now, you don't need a big, comprehensive book about the causes, the intricacies of prostate cancer. That is really irrelevant to you now. In making your decision about how to treat it, you need to know what is important and relevant in your circumstances. In my opinion, he is exactly right. I was given several books that were full of lots of information, but when I finished them, I was really no closer to making a decision, and most of the time, even more confused. The key thing to focus on in the beginning is making the right decision for you, not someone else. And I say that because everyone you talk to, whether it be a professional or even a fellow prostate cancer patient, they have an agenda, or as some call it, a dog in the race. Urologists are surgeons. They lean towards surgery. Radiologists lean towards radiation. You get the picture. However, what few seem to realize is anyone who's been treated will also have a bias towards the treatment that they chose, as they are justifying in their mind that indeed they made the right decision. So the bottom line is knowledge, and knowledge that is specific to your own situation. The problem is where to find it, and with the least amount of work and figuring out if it's right for you and your specific situation. So this is my job, is to help you find an easier way to get some of this information. So until next time, stop by our website at prostatecancerweekly.com or our blog at prostatecancerweeklyblog.com. Or you can even follow us on Twitter at PCA Weekly. Also, please feel free to forward this show to a friend. Thanks again, and see you next time.